What is a Dobhoff tube? A Dobhoff tube is a flexible, small-bore Nasogastric (NG) tube with an inside diameter of about 0.16 inches. For mom, it is primarily used to administer nutrients or medicine to patients who are unable to ingest anything by mouth. The Dobhoff tube was introduced in the mid-1970s by surgeons Robert Dobie and James Hofmeister, who combined their last names to create Dobhoff. The Dobhoff tube was the first small-bore feeding tube to be used successfully in hospitals. Uses of a Dobhoff tube: in addition to providing nutrition, a Dobhoff tube can also be used to give a patient medicine. Any medicine that is not already available in liquid form can usually be dissolved in juice or water and fed into the tube. Dobhoff tubes should be flushed before and after administering liquid food or medication in order to avoid blockage. Unlike the tubes used for gastrointestinal drainage, there is no suction attached to a Dobhoff tube. It is smaller and more flexible than other NG tubes, so it is usually more comfortable for the patient. Inserting a Dobhoff tube. A Dobhoff tube can be inserted at a patient's bedside by a nurse or physician. The tube is inserted into the stomach by way of the nasal passage. A guide wire called a stylet is used during insertion. The stylet is removed after the tube's correct placement has been confirmed. A Dobhoff tube has a weighted end that helps guide it through the digestive system. This weighted end consists of metal enclosed in silicone. Peristalsis, the involuntary constriction and relaxation of muscles, helps to move the weight through the esophagus and into the stomach or beyond. The end of the Dobhoff tube is often placed in the stomach, although it is generally recommended for it to be placed further on in the duodenum, the section of the small intestines that is adjacent to the stomach, in order to avoid any gastric reflux. After insertion, correct placement in the body is usually checked with the help of X-rays or fluoroscopy. Dobhoff tubes come with a radiopaque stripe, making them easily visible in X-rays. Potential complications. Some complications that could occur during the insertion of a Dobhoff tube include entering a bronchial tube, perforating the pleura surrounding a lung, not placing the tube far enough into the stomach, thus causing aspiration. Due to these potential complications, it is important to radiologically check the tubes post-insertion.